Welcome to the Killer Boobies podcast, Unraveling Breast Implant Illness. Here's your hosts, Wendy Bunnell, Leslie Smoot, and Brandy Vega.
Hey, thanks everyone for joining us on our Killer Boobies podcast today. Today, I have some special women that are going to join me, and they're special to me and to my heart because this is the team of women that I interacted with when I had my explant surgery. These women both work at Alpine Plastic Surgery in Ogden, Utah, at Doctor Barnett's office. Hi, you guys.
Hello.
Hi, Leslie. How are you?
Good, thank you. Okay, so let me introduce the both of you. I have Kristi Bergstrom. Kristi's the marketing director for Dr. Barnett, and she's able to interact with other women that are going through explant. She's able to interact with some of the breast implant illness groups, and she's really aware of what's happening. She's got her finger on the pulse online.
Yeah.
And thank you, Kristi, for being with us today.
Thank you.
And then we also have Miss Maddie Olson.
Hi.
Maddie is a medical assistant. She's an MA, and Maddie was my on-call nurse after I had my surgery, and she was able to receive text messages from me and even call me back and have on the phone dialogue to answer my questions and ease my concerns. And it was my lifeline because after you've had surgery, you have a lot of questions that you didn't think you'd have. And you just kind of need some moral support after that surgery. And that was Maddie. And I really, really appreciated that.
Oh, thank you.
And so I just thought it would be fun to have the two of you on here today to walk everyone through explant surgery and what happens. Both of you get all kinds of questions from women post-op. And I thought you could answer the kinds of questions that come up all the time. And I'm sure you've been on the phone today supporting the women.
Yes, every day.
Last week.
Yeah.
One of the best things that your office did for me and for other women that have had surgery is create this fabulous booklet that you sent home with me. And I think it has like 24 or 25 pages.
Yeah.
And this
fabulous.
booklet, you guys thought of every single question and every single concern, and you thought of tips and tricks that
Hopefully this one.
That's the one. That's the one. Yeah. And you know what's so funny, because after my surgery, I laid in bed and I went through that pages. I just went through the pages again and again.
Yeah.
And it really helped me because then I didn't have to call Maddie and harass her too much. But I had a girlfriend who was going through surgery just a week before me, and we were talking to one another, and I would pull open my booklet and say, okay, here's what it says about this. And my friend would say, oh, that really makes sense. And that helped my girlfriend. The other thing that was nice about it is just being a part of all of the Facebook groups and interacting with people. I actually used your booklet to answer some people's questions because it was fresh on my mind. I was just had surgery and had read this booklet multiple times. And so I think I was able to help other women because of your booklet. So I just want to applaud you guys and say thanks for creating something so amazing.
Yeah.
Oh, thank you.
Our cute Elise, our cosmetic coordinator who takes care of the consults and all that, she's the one that put that together, and it's been so amazing to have and so great for so many of our patients. So fabulous. It's been great to have.
Yeah, I think it's terrific. And so that's what we're going to kind of go through today. We're going to talk about some of the highlights of this booklet. So the first thing I wanted to start with is day after surgery. This is when the women wake up, and I'm just going to talk about my own experience.
I love it.
You made it through surgery, you slept all night, and then you wake up and you go, oh, wow, what happened to me yesterday?
Yep.
And you've got a few bullet points on here about the important things you want to go through and make sure you're doing starting on the day after surgery. Maddie, do you want to take us through those things?
Yes. So the first thing we always suggest to everybody, no matter what surgery it is, especially explant, is drinking lots of fluid and staying hydrated. It helps flush the anesthesia out of your system, and just making sure you're drinking enough, water, Gatorade, getting those electrolytes in, but obviously no alcohol, no soda, but just, staying hydrated is fabulous. We obviously want you to take it easy. That's probably one of the biggest things we'll tell everybody post-operatively, especially at explant. But we do obviously want you to get up and walk around, go to the bathroom every couple hours. But the biggest thing that we'll tell you is to take it easy and give your body the time it needs to heal. And the medications, obviously we go give you your medications. We go over your care with your caregiver, your medications in recovery. We go over all of those. We give you a list, your caregiver list of the medications. So staying on top of that, especially that first day post-operatively, just because you wake, like you said, you wake up and you're like, I just get hit by a truck. So, and then, eating starchy foods are great right after surgery, crackers, toast, Jell-O is great, soup, stuff like that. Just even if you are feeling a little nauseous, to keep something down and keep something in your stomach, especially when you're taking your medications.
Yeah, it seemed like I had to make sure that I had food in my stomach before I took the meds, or I'd get a little nauseous.
Yes. Yeah. What else have we got on there? We've got your garments, which obviously we put your garments on you afterwards, right? When you're still asleep, we put a bra and a compression wrap, making sure you've got those. You keep those on. No smoking. That's one of the little bullet points we've got on there. Smoking delays healing. The nicotine in the cigarette, vape, any type of nicotine causes your blood vessels to constrict. So especially if you have a lift, you're cutting all the way up that tissue, those blood vessels have to reconnect. That nicotine causes them to contract. You don't have any blood flow, that's when tissue dies, wounds happen. So not smoking 2 weeks before or post-operatively. That's another bullet point we've got on there.
Okay. That's a great list of things to know right out of the chutes. Some things you have to pay attention to. Okay. One of the things that was interesting when I had my surgery was going on to the Facebook groups, and I was specifically looking for people who had just had surgery. And some of the women like to brag about not using pain meds and recovering in 24 hours.
Yes.
So I just wonder if you might speak to that a little bit, because my recovery was actually, in comparison to that, I thought it was a rough recovery.
Much harder.
But the truth is, it was exactly what you told me it would be in the book. It's just that my mind thought that, oh, I'm going to be 24 hours and feeling.
Yeah.
You just talked about that.
Yes, I get that. That's a huge one I get. And I am very guilty of this, because I feel like it's just the comparison to everybody else's experience is a big thing. But you will get on, Facebook or talk to somebody and they're like, yeah, I was on no pain medication. This was the easiest thing ever. And then you have, whether it be you or another friend, and then you come into the office and you're like, dang, like this sucks. I feel like we all like to think that we're very tough and our bodies go through a lot and our bodies are very strong, but surgery can be hard, and it's normal for it to be hard. So it is hard when you see, some people are like, I'm not on pain meds, 24 hours later, I'm great, so, but everybody's so different, and that's across the board. Everybody's so different, has different experiences, heals differently. The biggest thing I tell anybody is just being patient with yourself, with the process, and then giving your body the time it needs to heal, because your body goes through a lot post-operatively in surgery. It's a lot of healing time. So just
and you get one opportunity.
Yep.
You don't ever get to have a do back on your post-surgery healing. That's it. So just do it right the first time. Be patient with it. Take it slow. Turn Facebook off if you have to. Don't compare yourself to anybody else.
Yeah.
And especially women in this situation, if you already have issues with inflammation and autoimmune, depending on what type of, the length of time you've been dealing with these things, it might take you 10 times longer than the next person. There's so many factors that I think we just have to, as women, we're hard enough on ourselves.
Right.
We just need to give ourselves a break.
Yes, I agree. I loved in your booklet, you actually used the phrase, recovery is not the time to be a superhero.
Yes.
And that was something I just said to myself every day when I got up. Like, I don't need to be a superhero.
Yep.
I need to take care of myself right now and lay low. And I just kept telling myself that so that I would resist trying to do more than I actually could.
Because as as women, as like a mother, people that work, like you want your go. You want to be able to just get back into those roles. But like you said, you've got to just take the time you need to for you, just to heal, recover, and don't be a superhero.
Yeah. Okay, so I have a long list of surgery questions from patients, but before I get into it, Maddie, Could you just take us through the top reasons why you would need to call a nurse? In other words, things that you really have to watch out for that could be a concern.
Biggest things we have people look out for are fever, redness, if your incision feels hot, any excess leakage from any incisions, and probably the number one thing we always want everybody to call us for is if one breast is significantly more swollen than the other. That's kind of the signs of, hematoma. It's normal to have that asymmetry post-operatively, and one is just a little bit more, whether it's a little higher than the other, or a little bit more swollen than the other, but the significance is where we start to worry about hematoma. Those are the biggest things. Obviously, we're here for lots of questions. It's a lot of information post-operatively we go over, but those are probably the main things: the fever, redness, and excess swelling on one side more than the other.
Okay. If you're swollen on one side, is it going to be also hard? Is it going
to hard,
have
firm, a lot more bruised on one side of the breast? That's kind of what you're looking at. And bruising is normal too. So that's where I feel like it does get hard to be like, oh no, I'm really bruised. But if you have a significant more amount of bruising and swelling on one side, then that's and even if you just have that little worry in your mind, one thing that's great, especially with the whole, texting process that we've got, is we can have people send in pictures, because we can't on the phone, know what things are looking like. Yeah. So we have you send in those pictures and then be able to really take a look and be like, no, that's okay, that's normal, because swelling's normal, but the significance in the swelling.
Well, and it's nice because then instead of, if there is something for concern, we can have the doctor put eyes on it.
Yes.
We can walk an iPad into his office and say, hey, this is a picture that just got sent in. Here's what is going on. What do you think? So that the man himself is the one who's telling us what's best for that patient.
Yep. Right. Okay. So what about if it's serious? How would a patient know if there's something serious enough that you need to just go into an emergency room? Have you ever had a situation like that?
No, because what we always tell people, and here's the thing, we have had girls that have had hematomas. It doesn't happen often, maybe like one or two, like a year, if that. But there have been times where we've had to come in on a Saturday, we've had to come in on a Sunday for somebody that has had hematoma. We always suggest you call us first before we do anything. That way we can say, hey, come up to the office, or go to the emergency room. We haven't really had, knock on wood now, anyone that's needed to go to the emergency room or for anything like that. Usually, for the most part, we're able to take care of most things. Not a lot of people get blood clots, because that's obviously a risk of surgery. Not a lot of people get blood clots because it is a very quick procedure. We keep sequentials on you to keep the blood flowing. We encourage, the movement post-operatively. But blood clots are always a possibility for anybody. They kind of start to appear about 10 to 12 days after surgery. If you have a hard time breathing, your legs and calves are swollen, and that's kind of things to look for blood clots. But luckily we don't have to deal with that really ever. So that's been good. But luckily we are able to take care of things here rather than going to the emergency room.
Okay, good. I think that puts our minds at ease.
Right? Yeah.
I appreciate you taking the time to go over the main concerns and the reasons why you should contact your nurse. And now I have a big, long list of questions.
Okay, let's do it.
And these are surgery questions that we get from patients because we're talking to people a lot that are going through surgery.
Yeah.
So first question is all about that compression garment.
Yes.
Why is it so important to wear the compression garment after having breast explant surgery?
So you obviously have that bra that we put on you, and then the compression wrap as well. I've actually got one right here. What that compression wrap does is it helps everything being held in makes everything just feel a little bit better, but it also helps swelling and prevents further fluid buildup. So you have those drains in, keeping everything nice and tight will help those drains come out quicker. After the drains are out, prevent that further fluid buildup so that your body can absorb the rest of that fluid, and it just feels a lot better to be held in, especially with all the swelling that you've got.
And doesn't it help the tissue and the muscle kind of stay in place?
Yep.
Yeah, because you have that implant in before and there was a void, and so you're keeping it compressed.
Yep.
At least that's how I understood it. I remember when you guys were telling me about that. So how long do you recommend that people wear the compression garment, and do they need to wear it day and night?
I at least until the drains come out, day and night. You know, you can throw it in the wash if you need to. You're okay to have it off long enough to, you know, adjust it or throw it in the wash and stuff. But at least about 2 or 3 days after the drains come out. And the drains, we can talk about that in a little bit, but that's anywhere between 2 to 14 days on the later end, you know, but at least 2 to 3 days, just because when those drains are out, prevents that further fluid buildup. But I always tell people to just keep it around, even if you're not wearing it, because I get about 3 weeks, 2-3 weeks, when people are starting to go back to work, they're doing a little bit more, they're exhausted at the end of the day, they're swollen. It just feels a little bit better just to, at the end of the day, to throw this on and just have that compression. So day and night for at least until a few days after the drains come out.
We sell those, right?
We sell these, and then we give you at least one.
So if you wanted to purchase a couple more just to have
extra
for rotation, we sell them.
And we give you one, obviously, but that's how long we want you to wear those.
Okay, great. Yeah, I think I wore mine the full 6 weeks.
Yeah, it feels good, right?
It did.
Yeah.
Good. I liked the tightness.
Yes.
To have my chest held into place. And maybe it was a little bit in my brain, but I kept thinking all these incision lines, I just don't want to move.
Yes. Yeah. No, I'm all about it. If you want to wear it longer than that, that's fabulous. I think it's great because it does feel good to be held in and to have all that there. So I think that's fabulous.
Okay, great. Okay. I'm going to pull open in the booklet page 22 because it's going to talk to us about swelling. I don't know if you see a lot of swelling with breast explant patients,
yes,
but let's go into that and let us know what you see and what to do about it.
So one thing that's actually great, I don't know, and we can talk about that in a little bit too, is the app that we have, the patient portal, the My Touch MD that we have for the patients. We actually have obviously before and after pictures in there, but I've gone through and I've made, I've kind of compiled like post-op, like 3-day post-op pictures compared with 6 months because of how things change. And that's kind of good for people post-operatively to look at and be like, okay, that's where things will get because it's swollen, it's scary, it's, that first little bit after surgery. You experience a lot of swelling right in the middle. It's like you have a pillow sitting right here. You have no defined cleavage because of all the swelling. Everything's kind of pushed up a little bit. And then you have a lot of major swelling on the side, especially if he has to do any liposuction on the side. You get swelling from that. And then the way that Dr. Barnett will suture that muscle down right here causes all that to swell over there. So swelling is crazy. And that's also what the wrap will help with. But swelling can be gnarly.
Okay, so here's what I was reading. And this is what's in your book. Okay, avoid salty foods. That makes sense because that'll increase swelling.
Yep.
Keep wearing your compression garment 24/7. And it says you also recommend wearing it for 6 weeks after surgery. Light physical activities such as walking will help with swelling. Also, rest and more rest.
Yep.
Remember, you're recovering.
Yep.
And the last thing you put on here is the more that you are up and doing things, the more swelling. So I guess that's a warning not to overdo your activity level.
Yes,
right?
Correct. Yes.
And that's something that women
it's hard not to. Yeah.
We just don't do it.
Yep.
We should, and we just don't.
Another thing that's really great for after surgery too is ice. Ice helps with swelling. Ice can help numb the nerves. So we always recommend, especially if you have a lift or lipo or anything like that, to just give you little ice packs so you can do peas, ice packs you have from home, throw them right on the sides. You can throw them right in the middle, on top, but just obviously not directly on your incisions so it doesn't constrict that blood flow, but everywhere else helps with the swelling as well.
Yeah, I think I used peas and it felt good.
It does,
it wasn't too cold, but it was very cooling.
Yeah. And you can't really move around a whole lot when you've covered yourself in ice pack.
Yeah.
Forces you to stay down.
Yeah. Yeah.
Well, you can't move when your hands are like this.
T-Rex arms. Yeah.
Why don't you explain the T-Rex arms?
No, so Dr. Barnett calls them T-Rex arms. So I think we've all just kind of adapted the T-Rex arms because they have the little arms that are like this. We don't want you to do for about 2 weeks after surgery. We don't want you to do anything like even just like lifting yourself up in bed, mowing the lawn if it's the winter, shoveling the snow, going to the grocery store and pushing a cart. I mean, after a little bit you can, wash your hair and stuff, but don't do anything too strenuous afterwards just to prevent bleeding so you don't get a hematoma. So that's why he calls those T-Rex arms, to make sure you're not moving those arms around, you're not creating
no jumping jacks,
no blooding, no jumping jacks, no bleeding. stuff like that. So those T-Rex arms are you keeping your arms to the side and not doing anything with them.
Okay, so we've mentioned hematoma twice. So maybe let's just dig into hematoma. What usually causes a hematoma? What would be that fine line between doing a little and doing too much?
Which it's crazy too, because after surgery, you kind of know, like if you go to reach for something or do something, your body will tell you, like, oop, that's too tight. Let's not do that. Any of those, you can have a little clot in your breast. And if you do a certain movement, any of those blood vessels can start bleeding. If you have a little pocket of fluid from, the drains or any sort of blood in there, that can obviously keep just bleeding. So it's just best you just don't move around, like keep those T-Rex arms so you don't cause any trauma to any of those blood vessels or cause any movement so it doesn't bleed for at least 2 weeks.
Right. Okay. Tell me about this. Like sometimes you have to put your hands down so that you can push yourself out of a chair. Is that too much or is that okay?
Sometimes it can be. We have had, this was over a year ago, but we did have one girl who was just, and she was go, 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 but just like lifting herself up in bed, like with both of her arms, it was just enough to cause that. So, you're gonna use a lot of your core muscles after your explant, so getting up in bed and kind of, rolling over. And if you can, just a little bit, but don't try and push yourself up too hard. A few years ago, we did have a girl who was, and she was like 10 days out and she was scrubbing her bathtub and then fell and used her hand and that caught herself on her arm. And that was just enough to like cause that little bit of bleeding. So it's just being very careful for 2 weeks.
Mm-hmm.
Resting.
And yeah, it's hard. Your body will tell you though what is when it's like, oh, I don't know about that.
I think the chore of scrubbing the bathtub is off the checklist.
Yeah, for quite a few weeks.
That's where you ask the person that's helping you.
Yes.
Yes.
Can you scrub my bathtub for me?
Or ignore it.
Yeah.
Like
it can wait a few weeks.
It'll wait.
Yeah.
Exactly. There is no rush. Okay. What are your tips for keeping the pain manageable after your surgery?
The biggest thing, obviously, and I think you'll kind of come to find that's a huge thing that we'll tell people is taking it easy. But it's sometimes when you get to be the 2-3 week period, it's hard not to because people are getting back to work, they're doing their daily things, but pain's going to be normal. It'll come and go. Staying on the pain medication, as you need to. That's going to be the biggest thing, taking it easy, wearing your compression garment, icing, and that's probably the biggest thing.
And fluid. I think a lot of people get dehydrated, and then once you're dehydrated, everything just hurts. There's not enough fluid in the muscle or in the tissue, and then it aches.
Yeah, I agree with that. If I'm dehydrated, I'll just get a headache.
Makes everything miserable.
Yeah. Now, when it comes to pain, I do remember, and Maddie, you'll probably remember me calling you or texting you. I had nerve pain post-op.
Yes.
And so maybe you could describe that and why people experience that.
Yeah, so nerve pain is, and it can be a dull, like burning pain. It can be sharp shooting shocks. A lot of people can get that after surgery. You have a lot of nerves running right along in here. A lot of times when we put those drains in, sometimes the drains inside will run along those nerves. And so that can be really irritating. A lot of times getting the drains out is a lot of relief for a lot of women, just because there's nothing rubbing on those nerves. But that nerve pain, because everything's so tight, the way you tax down that muscle, that goes away, for most people within a couple weeks. It could be 6 weeks, but that's, that sharp shooting pain. Sometimes it can radiate into your armpits and into your back, or just like burning. But it'll come and go too. It'll be like just very random. You do something, you're like, ooh, but
that's nervy.
That's nervy. That's a nerve pain. So that's kind of it's pretty typical too.
Yeah, you did a good job describing it. That's exactly what I went through.
Right?
The sharp pain, and it would catch me off guard, totally surprised. I'd grab myself and go, oh, ouch, I felt that.
How long did you feel like it went away for you?
I think it took a few weeks, and then it subsided.
Good.
It was alarming at the beginning, which is why we're talking about it.
Yeah.
I want people to know that's a possibility.
Yes. Yeah.
That you can get a sharp pain and it will surprise you, and that is nerve pain.
And it's okay. Yeah.
Yeah. Eventually my nerves healed correctly.
Yep.
I don't have any pains like that anymore.
Good.
I'm like 8 months after surgery. So, and they stopped within weeks. So it's not like it even lasted 3 months.
Good.
It healed relatively quickly.
Yeah. That's usually how how it is too. Heals pretty quickly, but that is a phone call we get a lot too. Is that sharp shooting pain? Is that normal?
Mhm.
And yes, it is.
Like take your breath away pain. Yeah.
Right. Yeah. All right. What's the proper care and treatment of the incisions and the dressing?
So all of your sutures are dissolvable with us. You may have sometimes here and there we'll have to put just one little single stitch in that will come out about 7 to 10 days afterwards. But we always tell people to just leave everything as is. We put little steri strips, so they're like little kind of like whitish band-aids type things around your incisions. If those haven't fallen off by like 10 to 14 days after surgery, we tell you can just peel them off. We suggest just taking some tweezers. You can get in the shower and get them wet a little bit, and then just peeling them off. And then after that, obviously leave your incisions as is. If anyone has questions about incisions or nervous about any sort of scabs, anything like that, call us, text us, send us pictures, but just kind of leave everything as is until the 6-week period. Keeping them clean. Obviously, if you are doing anything right here, washing your hands before,
Wearing gloves,
keeping your bra clean, stuff like that.
and that's where the maxi pads come in to put the sticky part in the bra, and then the soft part against your skin because they're sterile. It's not adhering to your skin, so no irritation.
Yeah.
Keeping it clean.
Yep.
Kristi, that is the most brilliant thing ever.
Right?
It was hilarious when I was doing it. And then, because I had removed all of the dressing, and then I was worried, okay, what if
a rub?
And I was so grateful that you had that in the booklet, and it was the most brilliant thing ever. And I was
fabulous.
laughing. I laughed so hard, and it's good to
have pads.
Feeling.
Yeah.
Yep.
Between nursing pads and padding liners, I think, or maxi pads, I think it's fabulous.
And inexpensive.
Very inexpensive.
Yeah, and I haven't had nursing pads in my house for 17 years, but I had panty liners. So to me, that was really helpful. All right, so the drains. Oh, the dreaded drains. I have to say that part was super uncomfortable.
Yes.
So what kind of tips and tricks do you have to get through the 2 weeks or whatever it is that you have to go and live with the drains?
So the biggest thing that I will tell anyone, or any of us will tell anyone with those drains in, is to take it easy. The more you're, moving around and doing, the more fluid your body's producing, the more fluid is coming out, and then the longer the drains have to stay in. So taking it easy, obviously not doing too much with your arms. That's probably the biggest thing that you can do for yourself, is just to chill. Even if your bandages are off and we totally gave you the okay to shower and stuff like that, just chill. Drains, how did you feel like the drains were? They're uncomfortable, but I think they're a little bit more scary than they really are, right?
Yeah, it's just this psychological game that plays on your mind.
They're intimidating.
Going inside your body. And you're collecting the blood. And, for some of us that don't like the look of blood, that's the part, it wasn't so much that it was painful. It just looked weird.
Yeah, it's crazy. And it's like, obviously your bodily fluids are just hanging out from underneath you. It's a little scary, but I feel like that's the biggest thing I get with a lot of women is they come into their pre-ops and they're very anxious about drains because they've never had them before. And then afterwards they're like, yeah, they weren't that great, but they weren't as bad as I thought they were going to be. So they're super easy to come out. They're just held in by a little stitch. So all we do is just clip that stitch and slide them on out. So they're easy to come out. It does feel good getting them out afterwards. Most girls, after we take them out and we put their clothes back on, they're like, oh, I feel like a little bit more free. Just because you don't have those bags hanging from you, and that kind of relieves a little bit of the nerve pain of those drains.
And that's what the thing that's going inside of you looks like.
Oh, wow.
And then the drain tube, and then the bulb. So that's what's collecting the fluid, and then pulling it out.
Depending on when your drains can come out, it all depends on you. I've had there was a pair of best friends that came in a little while ago, and one girl got her drains out at 3 weeks or 3 days, and the other got hers out at 10 days. And then the one at 10 days, she's like, well, why did she get her drains out at 3 days? And I was like, well, have you been doing a lot? And she's like, oh yeah, I was out gardening. And I was like, that's you're gonna keep your drains in for 10 days is gardening and doing more. And then as this other girl who got hers out at 3 days, she just took it easy. She's like, I've just been hanging out. I've been walking around, but I've just been hanging out. So that's the biggest thing you could do for yourself, is just to chill.
Yeah, that's a good tip. That's a really good tip. And it wasn't terrible to have the drain come out. I went to recover in southern Utah, and so I wasn't able to come back to your office, which is in Ogden. So it was the duty of my husband to clip the stitches and pull it out. He thought it was fun and fascinating, and I was like, I think I'm gonna hyperventilate.
Yeah, you're like, what'd you do to me? Yeah, we get a lot of gals from out of state too. So one thing we have is we've actually have made a little drain removal sheet with instructions, and we also have a video on our Instagram.
A video. She did a video.
Yes, we have a video on our Instagram of how to take the drains out, and it's like me, taking the drains out, and then it has a step-by-step of what to do afterwards. Okay. So that's really good too for our out-of-town girls, and those husbands that can take them out, and you're like, what did you do to me? Did you do that wrong? But yeah, it's nice to get them out though, for sure.
What is the name of your Instagram in case somebody just wants to look that up right now?
Yes, it's Alpine Plastic Surgery 1. And then our video of our drain removal is in our little highlight section above all of our posts.
Perfect. Okay, so now let's talk about other interesting body functions. It seems like the body became more constipated afterward. Is that normal after surgery? Does it have anything to do with anesthesia or what?
Yes, very normal. Anesthesia causes your bowels to go to sleep. We call it like paralyzing your bowels. And so same thing with narcotics. They can plug you up. And same, with anesthesia. So, laxatives are great. You can get started on those, but if it doesn't do the trick, you may need to go to milk of magnesia, prune juice, stuff like that. It's normal not to have a bowel movement for, 5 to 7 days. Days, yeah. But if you can get started on milk of magnesia, prune juice, things like that, then that's fabulous to kind of get the pipes moving a little quicker.
Yeah, I used magnesium, and it was very effective.
Yeah.
And hydrate.
Hydrate.
I think we forget how much. Drink half of your body weight in ounces per day in water, and just to keep everything functioning properly.
Yeah, that seems to stimulate the bowels when you have enough hydration.
Yes.
Correct. Okay. Great. What kind of items do you like to tell people to have in their post-op kit or something next to their bedside?
Yes. Some things that are great are like saltines. Saltines are great after surgery because it's starchy. It's something to eat, especially if you're still kind of out of it when you take your medication. Obviously, your medication. Ice. Straws are fabulous because it promotes hydration. You don't realize how much more you're drinking when you have a straw. Wet wipes, baby wipes to kind of clean yourself off, especially if you're not able to shower for a couple days after surgery. Kleenex, extra pillows, the maxi pads or panty liners, stuff like that. That's kind of things we tell you to get. What else?
I always like to have a towel.
Yeah, that's fabulous.
Just A, if I spilled anything, or B, if my neck was bugging me, or under an arm, or under my knees. Just
a nice change of clothes too, like just right next to you too. I feel like just even if you aren't, like I said, not able to shower, those baby wipes and then just throwing on a clean pair of clothes makes you feel a little bit more human.
Oh yeah, exactly. So much better. Yeah. And the hair ties, just to pull my
hair ties. Yeah.
Or even a
dry
brush.
shampoo. A brush. Yeah.
Those little toothbrushes that are disposable.
Yes. Oh yeah.
So you don't have to go all the way to your bathroom but even just to have those someone walks in and they want to visit you, it's like, hold on, let me.
Yeah. And then a full water bottle. I always wanted to have my water
bottle. Water.
Completely full. And if anyone came in to check on me, I'd say, go put some more water in this.
Yes, I love it.
Okay, you did mention shower. How long do people usually go before they can shower after this surgery?
So it kind of depends on your post-op appointment or when your drains can come out. If you come in for your post-op appointment and you're, whether it be 2-3 days after surgery and your drains aren't ready to come out, that's okay. You can still shower. We'll give you these little dressings called Tegaderm, and they're like a little clear plastic dressing that we show you how to put right where the drain's going into your body, so that no water, soap, bacteria is going into that little tunnel we've got that drain going in. And then we give you a little lanyard so you can safety pin your drains to the lanyard, and that way you're not like, what do I do with them? Do I just throw them over my shoulder? But when your drains can come out, depending on when that is, you can for sure shower that night or the next day. So it can vary anywhere between 2 to 5, 7, 6, 7 days that you can't shower until.
Mm-hmm.
Well,
Yeah.
and I had a tummy tuck, but I used saran wrap
Yeah.
and just had my husband kind of go around the bandage and the incisions with saran wrap because it stuck to itself.
If you don't have
It
to
covered my drains,
run out, yeah.
and I didn't have to worry about anything getting in there, but I could still wash those parts of my body that needed to be washed. So, and I put a chair in my shower.
Yeah, a chair
so that I didn't get too tired.
Yeah, a chair is fabulous. Because we take that compression wrap off you the first time, or if you do take it off, sometimes the blood will rush there, and then being in the hot water, and then sometimes it can just be like, like a little much.
And you get lightheaded.
So a chair is fabulous, but saran wrap is great too. So
Yeah, those are great ideas. I do remember you gave me Tegaderm?
Tegaderm, yeah.
Tegaderm. You gave me that, and I felt so amazing after I showered.
Right?
I was so grateful.
Yeah.
It's funny, our culture showers like all the time.
Yeah.
So when you can't shower, you feel kind of grimy and gross, and it felt
Yes.
so good to be able to shower.
Right.
So I was really grateful that your office gave me that and taught me how to do it.
Oh,
So
good.
that I could safely get in and shower still with my drains in.
I'm so glad. Good.
All right. So now let's talk about some of the things that aren't physical, but definitely are real. What I'm referring to is that emotional ups and downs after surgery.
Oh, yes.
Yes. It's one of the biggest things that we get. Anesthesia messes with your emotion. Surgery is like trauma to your body, and it's an exhausting thing to go through. So no matter what surgery it is, I think it could even be knee surgery. You're going to get like the baby blues pretty much. You're going to go through this wave of emotions like, what did I do? Did I make the right choice? Why am I not healing faster than this person? Your body's gone through a lot, your mind's gone through a lot, and patience is key with surgery in general, but especially something like this, between healing and then also the physical aspect, a physical aspect of it.
Mm-hmm.
So patience is key too, and not a lot of people have patience, and it's a very mentally exhausting thing to go through for sure.
Well, I think a lot of people don't realize that when you're coming to a cosmetic or plastic surgeon's office to have surgery, it's not because you need a knee replacement because you're in so much pain, or that you need a hip replacement, or that you need, something's broken. You're coming in for something that, for lack of a better term, is elective. So you don't necessarily, you're not in so much pain you can't wait to get it fixed right now.
Yeah.
So you don't leave here feeling better than what you came in.
Yeah.
And I think for a lot of women that's super hard. And the fact that we chose to do this to ourselves, I think that brings in mom guilt. And then what was I thinking? I'm not taking care of my family. I need to get up. I should be vacuuming. I should, and then
making dinner,
trickle down effect.
Should be back at work. Yeah.
Not getting better. So
yeah. Well, I'm also going to add in, like, when I first had my augmentation and I went from a B to a C, full C, I remember emotionally I was like, wow, okay, that looks good, and I could get through the physical struggles. When I had the reverse surgery where the explant happening, and I had been sick with BII symptoms, and I'm looking at a whole lot more stitches because I had a lift. There was a little bit of emotional trauma of, oh my gosh, this is scary.
Yeah, and that's kind of what we're here for too, is it's easy for us to see because we'll look at something 3 days post-op where it looks very scary, it looks break boob, you're like, oh no, what did I do? But we see them every day, so it's easy for us to be like, oh, those are gonna look so good, like I'm so excited for you. But were you the patient, I know if it were me too, even knowing everything, I would be the same way. But as the patient, you're just kind of like, oh crap, like you said, you've never had a lift before, so having lift, it is a lot more sutures or a bigger incision than you're used to, and so you're just like nervous about that, and it's just a lot. It's a little bit more.
Well, and frankenboob is the term I hear on Facebook all the time. Frankenboob, and I'm like,
that's what it looks like.
Yeah, that's what I thought about my stomach after my first C-section. I looked at it and went, oh my gosh, that's how many staples still stuck in the front of me. And then after my tummy tuck, but it was, oh yay, all that skin is gone and my muscles are back together. Like you said, you have surgery and you're excited about the outcome. With explant, I think it's you're excited for what is going to be the outcome, but you didn't leave here thinking, I just paid so much money to look better, to be happier with something about my body.
Right.
So it's, that whole emotional roller coaster, and then go ahead and add in anesthesia and mom guilt.
And it can be hard. I've had a lot of girls too saying, like, you know, they have their implants in for 15, 20 years, and it becomes a part of you, you know? And so a lot of times, a lot of girls struggle with that part of it, where they've had them for so long, and getting them out, they will say it's like losing a limb. And I mean, and some girls will be like, God, I'm sorry, that's dramatic. I'm like, no, it's not. Like, I get it. Like, it is a part of you. It's been there for so long, you know? It is like losing a limb. So that can be really hard for a lot of girls too, even if, you know, it's their health versus the appearance of them, you know? And Dr. Barnett does a really good job anyway, and can make them look really great, but it is hard to get rid of those, you know?
Well, and you got them for a reason.
Yeah.
There was something about your body that you weren't happy with. So you got them for a reason, and you're removing them for a reason as well. But I think as far as the image factor, the explant is a lot harder than having them implanted. Emotionally.
Yeah, I agree.
Yeah, it definitely is. There was also this weird factor of, I did it when my children were babies. It was like a mommy. And my babies are, you know, teenagers and adults. And so there was this needing to be accepted by them, just because I'm like, okay, you've always known me with big boobs. You know, this, and they're not small, so I'm not saying it's too small, but it's a change.
And change is hard. Like, even if it is a good, like, change is hard.
But the post-op blues is very real, and it's normal for a girl to feel happy one day and sobbing the next day.
Within hours, happy at noon and sobbing by 7.
I've had girls I've talked to, at noon, and then they're great, and then 4 o'clock rolls around and they're calling me crying, and it's normal, and it's hard, and it's, you know, but it gets better.
Well, thank you for sharing that, because that's real. All right. Does the energy level go up and down just like the emotions do?
Yes. Oh, yeah. You'll, you know, wake up one day, and I feel like that happens a lot when you start getting more into people that are going back to work, or hitting that 2-3 week period where they're able to do a little bit more. You know, you'll wake up that day and you'll be like, oh, I'm kind of ready to go. I'm getting back into work. You'll be doing a lot. And by the end of the day, you are wiped out. And that is any surgery too, and it's just it's exhausting, and it can be a lot, and I think that's where a lot of women get frustrated too, and that can play into a lot of the emotional aspect of it as well, where you just are like, why am I so tired? Why am I not healed yet? Like, it can be exhausting. And I get a lot too, I think I mentioned that to you as well, like, it's about like really the 5-6 week period where girls are like, I started feeling a little bit more like myself and normal, and like getting that energy back. Is that 5-6 week period, and that seems like a long time, and it is. But I think you hear a lot of girls too, like you said earlier, you know, they don't take any pain medication. 24 hours later, they're amazing and healed and all these things. But for a lot of girls, it's realistically like 5-6 weeks that they're more like starting to be themselves.
Well, and then you have to remember that like 6-week mark is usually when you're cleared to go ahead and start exercising again. So then you add exercise. Your normal routine is not going to be what it was as far as exercise goes. And once you do start, say, lifting or running or whatever it is, then those tissues start swelling again, because it's more movement than you've had for the last 6 weeks. So then you start lifting, and then you come home and you're swollen and you ache and you're tired, and it's 6 weeks. What's wrong with me? Why can't I do this? When in reality, it takes a full year for our bodies to totally heal from surgery.
I think we underestimate how much energy it takes for the body to heal. We're just a culture that wants everything instant and fast.
Oh, for sure. Yeah.
So it's a good lesson in patience and self-love and giving yourself time.
Yes.
It's huge.
Okay, I'm going to ask the question that nobody wants to ask out loud, but everybody wants to know the answer. Yes, it includes a question about sex. After you've had surgery, when can you start having sex again?
You know, that's a really hard question. It depends. It obviously depends on the surgery, but explant, it's honestly all up to you. I would wait about 2 weeks. You know, if you are dead fishing it at 10 days and just laying there, go for it. If you need it, go for it. But you're going to be tired. So at least 2 weeks before you're kind of, going around doing your thing. But at least 2 weeks, and you can kind of start getting more into it. But be gentle. Make sure your hubby, whoever, is being gentle, not grabbing onto him too hard and stuff like that. But I'd say about 2 weeks.
Yeah. And just make sure you're putting yourself in a position where you're not using these arms.
Exactly.
Okay, well, thank you. Okay, well, we're about ready to wrap it up, but I just have a question about the breasts. I know, like you said, you see patients every day, and I know that the scars change over the time, and I know that the breast will change over time. I remember right after surgery, it seemed like my breasts were flat and up here, and now they've settled into shape, and my gosh, they look beautiful now. Not bragging, but Dr. Barnett did a really good job.
He is awesome. Yeah,
So,
he's fabulous.
It's obvious to me that it changes over time. How would you articulate that and describe it for women?
Right after surgery, we talked about the swelling earlier. You're going to be very swollen. You're going to be bruised. Things are frankenboob. And like you said, you're really puckered, kind of flat underneath here. You can have a little bit more puckering on one side. But that's just the way that Dr. Barnett will suture that muscle over on the side. And then down here, what he does is he tacks that in and kind of overcorrects everything up super high, so that when everything fluffs and settles down and the swelling goes down, that they will round out and they won't bottom out and be really, really low.
And the stitches dissolve, so you have to give that time as well.
And so that can take upwards of 6 to 9 months.
Mm-hmm.
You could come back here at 6 weeks and things could look awesome. You may still have a little bit of puckering on the sides and in the middle. You could have a little dog ear on that little excess tissue on one side, and then you come back 6, 7, 8 months later, they round out a lot more. Your scars have started to fade. They have that time for those sutures to dissolve and round out a lot more, but they continue to change even after that 6-week mark. I think a lot of girls get that 6-week mark in their head and they're like, okay, after 6 weeks they're done healing. No, they're gonna keep fluffing. They're gonna keep relaxing. The scars are gonna fade. They're gonna change. So it a lot changes even into over a year.
Well, and that's why if there is a revision that's needed, Dr. Barnett won't do it before the 1 year mark, just because there is still so much change that's going to happen with those tissues and with your body.
Kristi, when you talked about your tummy tuck, that's a big, long incision. I'm not sure how long it's been, but maybe you could describe a really far down the road scar and how it changes over the years.
So my incision, when I first got it, it was kind of pinky dark purple and really tight. I kind of felt like everything was sucked up and under. And firm. And after the 1 year mark, I could tell that it was kind of softening, and I felt like I still had a dog ear on my one hip. It's been almost 3 years for me, and I just noticed the other day, I'm like, oh, that dog ear is gone. And mine came down because he did a butt lift on me as well. So my incisions actually come to about the middle of my glute. And those, when I first got it, I felt like were kind of this funny triangle cut into either side. And now all of that's relaxed. And I'm like, oh, I have a nice little round bum now. And my incision is, it's super light, just like untanned skin. Like the rest of me got a suntan, but that area didn't.
Okay, so it went from a pink color to a light color, and it shrinks also, right? It pulls in and it pulls together, so it's a smaller line
and flattens out, like it's you wouldn't know it was there.
Okay, and would it be fair to say that breasts are going to do the same thing? The scar tissue on the body is just going to most likely do the same thing.
Well, and that's, so if you have the tendency to get a keloid scar, or your scars stay dark or really pink anywhere on your body, it's going to be like that. But if you scar pretty, shall we say, your scars seem to fade, it'll be the same way. You just have to give it time.
And they continue, those scars continue to lighten and mature even up to 2 years. And the scar tissue can feel like firm and hard, and you can feel like kind of lumps on it for upwards of like 6 months. But then, and a lot of times that's those sutures in there that you feel too. But once that all dissolves, it's a lot softer.
Okay. So here's my last question about scars. Is there ever any cream or ointment that you recommend that people might use to help?
Anything silicone based is great. Silicone strips, silicone cream, but not a lot of girls want to use silicone after they get their implants out. So vitamin E oil is fabulous. They come in like a little chapstick form too, that you can just kind of like apply on your scar, or just crack open a little pill and
vitamin E capsule.
Little capsule, and then put that on your scar. Bio oil is awesome. I know people use that for stretch marks, scars. You can get that on Target, Amazon, or I've had a couple girls lately tell me Manuka honey. I'm not sure about that, but I've had like quite a handful of girls tell me that lately, that that's what they've been using.
Okay. Well, I really appreciated the time you guys have spent with me.
Hey,
this
thanks.
so fun.
Yay, it's been a blast.
Yeah. Well, is there any last tip or suggestion or thing that you want women to remember when they go in, and what it'll be like on the explant surgery side? Is there any last thing you would want to say to women?
You know, like we said earlier, give your body the time it needs to heal. Don't be a superhero. You know, things are going to continue to change over time, and patience is key. Be patient with yourself. Be patient with everything else around you and your body and all that good stuff.
Well, and remember, you only get one opportunity to heal. You get to do this one time. You can do the laundry again. You can scrub the bathtub again. This is one and done. So just do it right the first time. And seriously, do nothing. Do absolutely nothing. I know it drives us crazy. Do it anyway. Do nothing.
Amen. That was really good. Yeah, that's important. Yes. And that's a perfect way to end. I hope women will take that to heart. They're heading into surgery. Thanks again for joining us
so
today.
much, Leslie.
Thank you.
Thank you for listening. Spread the word by subscribing, liking, and sharing the Killer Boobies podcast today. You could be the person who helps someone reverse their pain and suffering and reclaim their health today.